I work as a freelancer and I am also working as a lecturer in HPT Arts College, Nasik. And it's a great pleasure and honor that I am here and representing as a guest speaker. And we are going to talk about a really exciting and relatively new field about psychology. In psychology, it is a very new field and we don't talk much about it, but today I have got an opportunity because of Insight, and I am thankful to Insight that they are hosting such kind of webinars for all of you. So without wasting any time, we will just dive into our today's topic, that is health psychology. I'll be giving you a little bit information like what health psychology is, where a health psychologist works, and what is the importance of the health psychologist. So your questions are welcome, your queries are also welcome. And let's begin with our today's topic. So health psychology, as I told you, is a very exciting and relatively new field which is devoted to understand the psychological influence on how people stay healthy, or when they fall ill, or how they recover from the illnesses. So basically a health psychologist works in these three areas: in diagnosis, in treatment, and to uncover the causes that why a person is getting ill, or are there any habits or any lifestyle issues or faulty behavioral patterns that are affecting their health. Now we have talked about mental health in this pandemic a lot. Okay, we have also talked about physical health, but however we have not often come across this thought that physical health and mental health are interdependent. Sometimes we get physically ill because we are psychologically upset, or we have some trauma or stress going on, and it results into the physical ailments. As well as sometimes we are physically ill and that impacts our mental health or psychological health. So health psychology stands between these two, physical health and mental health, and tries to explore how exactly it impacts each other, how both this physical health and mental health is related and dependent on each other. Before moving forward, I would just like to tell you what exactly is health. Okay, now many of us have this assumption that if we are not ill, if we don't have any kind of diseases, if we don't have cold, fever, or we are functioning properly, then we are healthy. Well, spoiler alert, it is not like that. It's nothing like if you are if you don't have any disease, then you are healthy. According to WHO, health is a complete state of physical, mental, and social well-being. They have given in this definition that there are three aspects we should consider, that is how we are physically functioning, sorry, how we are functioning mentally, as well as how we are functioning in a society. So all this component leads to the health. So health is a complete state of physical, mental, social well-being, and not merely the absence of the disease or infirmity. Okay, and we use wellness to refer this optimum state of level. That is when we say that we are no, don't have any kind of diseases, or when we are completely uh, what we can say, functioning very well in physically, when we are functioning very well mentally, when we are functioning in society very well, that state of mind or state of body is called as the wellness. Now many of us have come across this and have experienced this time and again, that our mind and body have some kind of impact on each other. For example, I can say if I'm getting a cold or I'm feeling feverish, then it upsets my mood, or it makes me feel dull, it makes me feel very ill, sick, and also tired we can say we are not very enthusiastic. Also my emotional state changes whenever I have a small disease or any kind of physical ailment that affects me mentally as well. I'm sure that must be happening with you also, because we have observed this whenever we fall ill or whenever we have any chronic illness. If we say, if we are struggling through typhoid, jaundice or dengue we are having, so we are resting and taking a lot of medications, and that kind of have a great impact on our mind or a mental state or psychological state, right? Whenever we take this heavy dosage or medications, जब हम ऐसे दवाइयाँ लेते हैं to treat the very serious problems, it takes a toll on our mind, not only on our body. We feel very tired, we don't feel enthusiastic, we don't feel like doing anything. Of course our body is tired, but at the same time our mind is also tired. Okay. And many of the times it happens that if we are struggling through that disease, or if we have that disease for a really long period of time, then we become kind of helpless, and there is this hopelessness that maybe we cannot get recovered. Even when I discuss this about health, or when we are sick with our friends, they also tells us that even when you feel feverish, or even when you have a fever, you feel like that you are never going to get recovered. Maybe this is the end of the world, and maybe you will never get out of this bed and do whatever you were doing or get back to work. Because however that physical state affects our mind so much. So why this happens, and many of the scientists, many of the psychologists, many of the physicists, physicians as well have tried to study this relationship between the mind and the body. Now in historic or prehistoric times we can say that this relationship, or whenever a person used to get ill, or physically and mentally, it was considered that that person have evil spirits that is inside his or her body, that is the evil spirits have entered the body, and that's what is making that person behave or feel physically or mentally uh, whatever they are feeling. And many of the skulls that are extracted from the stone age have this small holes in their skull. And many of the scriptures and many of the pictures have shown that this was the treatment used when a person used to get ill into the prehistoric times. So they used to make a small hole in the skull, so that the evil spirit that have entered the body can leave the body, and a person can get physically as well as mentally functioning again. So yeah, I know it is a very ill treatment people used to give to another human being when they are suffering. But there was lack of knowledge, there was no technology, everything was new, and whatever happened was happening for the first time. Like even the cold and fever, it was a first hand experience of a human being towards all these kinds of diseases and infection. However, after prehistoric times in Greece, it was studied that, or it was believed that the mind is really very important, and whatever that happens in our body or mind is because of the four humors or four fluids, we can say, four liquids in our body that affects the whole system. There is the balance of these four fluids in our body, which is called as blood, black bile, yellow bile, and phlegm. And if these any of these four liquid is out of balance, then it can create a we can say, it can lead to the diseases or the physical ailments or the mental ailments. For many years this was believed, because this was the only reasonable explanation after war, after the prehistoric times. Okay. However, in the middle ages again, it was believed that no, nothing was related to these four fluids, but there was in fact a evil spirit that is harming people in many ways. Okay. uh, However, in the Renaissance and till the present day, or we can say after 16th 17th century, uh, it it started to change. This concept started to change, and mind and body was seen as a one unit. Till then, mind and body was treated as different, that there is in simple language, there was no impact on our mind when we are physically ill, and there is no impact on our physical body when we are sick mentally, or when we are struggling psychologically. But after that, or in after 19th century or so, this concept changed, and it was believed that a mind and body is actually a one unit and have a great impact on each other when one is affected. We have all heard the name Sigmund Freud. He is known as the father of psychology, and he have developed this personality theory, which is like a groundwork for many personality theories that have been formed after that. And he was the one that believed that whenever we have some unconscious conflict, or when we are suffering psychologically, when we are having some kind of stress that is bothering us, it directly affects on the physical body, or we show physical symptoms, which are commonly known as psychosomatic symptoms in the present world. That is, if your hand is aching, अगर आपका हाथ दर्द हो रहा है, and there is no physical cause behind that pain, there is a possibility that is you are struggling with something in your life on a psychological level. That is, you have some conflict going on, there are some hard decisions to take, you are struggling through stressful situations, and as a result, your hand is in ache, राइट. आपका हाथ दर्द इसलिए कर रहा है क्योंकि आपको कोई ऑलरेडी मेंटली स्ट्रेस है, या आपको कोई अनकॉन्शियस कॉन्फ्लिक्ट जो है आपके मन के अंदर, वो आपको परेशान कर रहा है. Okay. So this is how the mind and body relationship was studied over the years, and currently this belief is accepted, that yes, they are one unit and they have a large impact on each other. uh, Now, number of factors have been contributing to physical health and diseases. Okay, it includes genes, our lifestyle. If we are taking a look or a perspective from a health psychology, then these are the very factors that can affect our health very much. That is, there is a biological factor that some diseases are passed on genetically. For example, diabetes, heart problems, high blood pressure, and sometimes cancer genes. Sometimes many of the mental illnesses or psychological illnesses are passed genetically. So genes or biological factor is one of the factor. Then there is lifestyle, how we are functioning on day to day basis. Then our personality also matters. How is our personality, how we how our temperament is, how we adapt to the situation, how we adapt to the changes that occurs around us, within us, affects our physical as well as the mental health on a larger extent. Then these all factors work together. There is no one sole cause or one sole factor that affects the most, but these are three to four factors that have an impact or have an important role to play when we are talking about why a person gets ill, or why a person gets such XYZ disease, or why that person is suffering through this chronic illness throughout his life. So these are some of the reasons. Now there are also two models that explains this. As I said in before, in prehistory, or when there was scientific developments, when people were talking about physics, when people were talking about physical health, when people were talking about mental health, when there were inventions, and the world was changing, there was this one model which was called as the biomedical model, which considered that whatever we are suffering physically or mentally is because of some external factors. Okay, so basically human beings were seen as a victim uh, because of the changing environment, because of the changing eating patterns, and because of the we can say changing lifestyle, or infections. We can say there were so many infections when when there was this industrial change, or when there were industrial revolutions happening around the world, inventions were happening around the world. So there were many infections. So basically a human being was considered as the victim of all these things. And uh, it was uh, not thought that maybe we are human being are sometimes responsible for their own health. This approach was taken, however, in the second model that was proposed, which was called as the biopsychosocial model. So, like I said, that Freud was the one who tried to talk about this, that our internal conflicts affects our physical health. During that same period, this biopsychosocial model was established, and it kind of changed the viewpoint what biomedical told us, that biopsychosocial model told us that maybe it's not just the environment that is affecting your health, but it is also about how you are acting, how you are living your life, how you are functioning, how you are dealing with your life problems can have a great impact on this question that why human beings get ill. So basically in biopsychosocial model, an individual was not considered as a victim, but sometimes he was the reason or the cause for his own illness or for the diseases that he was suffering from. Okay, so these were the two models that were extensively studied, that are extensively studied in the health psychology. And biopsychosocial model is the one which is currently used when we are talking about the health psychology. Now, you must be wondering that where a health psychologist work, and we were talking about that why health psychology studies all of this thing. But when we are talking about the job prospects, or when if many of you must have been or our psychology students are from psychology background, and you must be interested to know that where a psychologist can or a health psychologist can work. Well, a health psychologist can work along with the physicians in the hospitals, in the uh, critical departments. We can say chronic illness ka department hota hai. For example, there is a cancer hospital or cancer department in any one hospital, or diabetes or heart patients के लिए कोई compartments होते हैं, कोई departments होते हैं एक hospital के अंदर. वहाँ पे एक health psychologist जो है काम कर सकता है. Then a health psychologist can work in a सोशल प्लेटफॉर्म, और वी कैन से कम्युनिटी हेल्थ में वो काम कर सकता है, जहाँ पे नंबर ऑफ पेशेंट्स कम एंड सीक ट्रीटमेंट. ऑल्सो हेल्थ साइकोलॉजिस्ट कैन work as a researcher, because there is a great need now. The research is flourishing, and because of the research only we are able to study that why a person gets ill, how that disease is maintained because of that person's behavior or habits, or what can we do as a treatment, what can we do to give the better treatment to that person, or उसका ट्रीटमेंट जो है वो लेस पेनफुल हो. बिकॉज व्हेन वी आर टॉकिंग अबाउट द कैंसर, इट इज अ मेजर chronic illness, and the treatment part is basically very very painful. So a health psychologist can work in such areas to make the diagnosis more efficient, to understand what underlying factors that are maintaining that disease. For example, there are allergies or some chronic illnesses that are maintained because of the stress or lifestyle patterns. So health psychologist can uncover that. Also a health psychologist can take initiative in making the treatment less painful, and trying to counsel the patient itself to undergo this treatment process, to make that patient understand how this will work, how much time will be invested, and how they can cope with the side effects of the treatment or medication, or what they can do along with taking medications. So all of this includes a job profile of a health psychologist, and it's really a fascinating field because now that we are in a middle of the pandemic, health psychologist is needed. I was talking to one of the colleague who works in a district hospital, and he is in the psychiatric ward, in the addiction ward actually, and he noticed this, that many when the coronavirus testings were going on, and even today it is going on, there were some पेशेंट्स हु वर असिम्टोमेटिक, दैट इज उनको कोई भी सिम्टम्स नहीं थे, फिर भी उनके टेस्ट जो है वो पॉजिटिव आ रहे थे. सो दे वर ट्राइंग टू स्टडी अबाउट दैट, एंड देयर वाज अ लॉट ऑफ फियर एंड पैनिक spread among the people when they were in the initial stages of the coronavirus. But that was an interesting fact, that even though people were not having any kinds of symptoms, they were tested positive. Now there must be a faulty tests, or there might be one of this reason, that the panic and the stress, people were under that stress and panic, and that's why they were, it was affecting their immune system in some way and affecting that test results. So it can be anything. So it was really fascinating to know, and in such kind of infections, or in such kind of pandemics that human race have already experienced, we can study those pandemics or those illnesses, because of the sorry, with the help of the health psychology, and can uncover the reasons, or can uncover actually the cure for all such kinds of diseases, or we can actually formulate we can say a less painful treatment pattern, less. Also, we can come up with the preventive measures, because the main goal of the health psychology is to prevent all these kinds of diseases. Even though health psychology helps in diagnosis, uncovering the causes, and treatment, our main job as a health psychologist will be to prevent these kinds of diseases, right? So these are some of the areas where a health psychologist can work, and it is really fascinating for me as I am from the psychology field. And there are so many options opening up, because earlier there was just clinical psychology. Sports psychology is also very rare field. Then there is industrial psychology, school psychology, counseling psychology, but these are the fields that are coming up, and which are really fascinating and can have a great impact on human race. And a wide range of human behavior can be studied if we try to work in this various we can say various fields, or various subfields of human behavior. Because where there is human mind, where there are humans, there will be a scope to study about them. And thanks to health psychology, they are studying the behavior of a person in medical field. Okay, moving forward, why this field was created, or why health psychology was developed. Some of the reasons that health psychology was developed was because of changing patterns of illness. That is, earlier illnesses were acute disorders. Acute means that lasted for a short period of time. For example, there were viral bacterial infections, then influenzas, measles, or such kind of diseases which affects a person's to hardly 2 to 3 weeks. But now the pattern of the illnesses have changed altogether. That is, now there are chronic illnesses, and some of the chronic illnesses are heart diseases, heart attacks. The rate of heart attacks are increasing, the rate of respiratory diseases are increasing, which contributes to the death. And these some of the diseases that affects a human being for a longer period of time. That's why it is called a chronic illness. Okay, so there is diabetes, then there is cancer, and some of these diseases are not even curable. Okay, like some cancers are not curable, some HIV AIDS is not curable, or diabetes is not curable. But a doctor can help a patient to maintain a healthy body, maintain a healthy lifestyle, so that they can at least function properly throughout the years, however how many years they have left in their left for them. But yeah, so these changing patterns of the illnesses led to the formation of the health psychology to understand initially why these diseases occur and how those disease transform into a chronic one, or how we can actually help the patient who is suffering from a chronic illness, who is going to die after a few years or 6 months, how we can increase their life expectancy, how we can increase the time they are alive, and how they can lead a we can say a balanced life, a functioning life until they are alive. So these are some of this is one of the reason. Next one is the there is very advancement in the technology and research. There is so much research happening, and even after the industrial revolution, physicians were studying body and mind, and philosophers were studying mind initially, then the psychologists, neurologists, and psychiatrists started studying mind, and these all fields came into light, as well as there are new medical technologies, okay, for curing all these physical ailments, and it led to the development of the health psychologist. Okay, so advance in technology and research have this one benefit, that we can actually study the contribution of the genetic factor. When I talked about it earlier, that genes or biological factor is the most important factor, or one of the important factor that can cause a physical ailment or physical problem. So advancement in technology and research have given us this opportunity to study the genetic contribution to diseases, and actually help the future generation to take some preventive measures to change something in their lifestyle, to change some faulty habits, behavioral patterns that can actually protect them from having this chronic illness. For example, if my grandfather have was say heart disease or high blood pressure or diabetes problem, then I am more prone to all such kind of chronic diseases. And when a health psychologist assist me, and they know that I have this family history and I may have such kind of diseases, then they can guide me to how to take care of myself beforehand, so that I won't develop all these kinds of diseases. Even if I develop, god forbid, then I have how what can I do to keep it on the lower level, or how I can maintain the balance, how I can maintain the highest healthy lifestyle for my sake, and for the sake that the disease would not increase in the intensity or would not become fatal, right? Some diabetes become fatal, some does not. So that's how I can be protected. Even the breast cancer is one of the most common disease, chronic illness that have been seen among the women. And because of the advancement in technology and research, there are some preventive measures, there are some we can say some changes we can make in our lifestyle, or there is at least awareness that is spreading about all these chronic illnesses, and that is the foremost thing we can do when we are a health psychologist or working as a health psychologist. So this is also one of the reason, as well as there is increased acceptance of you can say medical field or medicine or illness. People are getting more and more aware about the various types of illnesses that are going on, and they're more accepting towards the treatment, because there is such technological advancement that the treatment have become less painful, and mostly there is no pain in treatments, in operations. There are some after effects, obviously there are some side effects as well, but the treatment have become less painful, and people are getting more accepting towards all these factors, and that is a very good thing. So that's why health psychologist can flourish. Health psychologist can actually help and contribute a rich amount of value in the medical field. The last factor that is the reason for the health psychology is expanded healthcare services. Okay, now it have been observed that healthcare is the largest service industry in the United States. Okay, it is growing rapidly, and it have been observed that Americans spend more than 3 trillion annually on the healthcare, only just healthcare. And even in India, a large sum of amount is spent on the healthcare, and much amount is spent on that. So this is also one of the reason that health psychology is, or health psychologists are working with the medical professionals, because containing this healthcare cost is so important. Health psychologists emphasis on the prevention. Like I said, their important goal is the prevention, because they know that the treatment can be harmful, or treatment can be painful, the process can be painful for that patient, and it can really lead to many disastrous effects on their mind or psychological health as well. So their main aim is to no emphasis on the prevention, that how we can prevent it, so that that suffering will be saved, so the money will be saved, so that many years will be saved, which are spent in that suffering through that chronic illness. So modifying risky health behaviors is one of the tasks for a health psychologist, which can reduce the healthcare service cost. As well as health psychologists know what people makes satisfied and dissatisfied with their healthcare, so they can actually help a hospital, or a community hospital, or any institution that is providing the medical care, to give it more effectively, how they can use more effective treatments, how they can communicate with their patients. They can train the staff members, the nurses, the doctors as well, to communicate efficiently, that can help provide satisfying healthcare services out there. Also, health psychologists or health industry employs millions of people. Nearly every person in the country has direct contact with the healthcare system, right? So the communication or the contact between them is very very important. The feedback of the patient can be noticed, verified, or can be assessed with the help of the health psychologist, because that job cannot be done by the medical professional, because he have to he is more into, or she is more into treating the diseases. But the extra work that is also important, that feedback of the patients, or are they getting the good treatment, how they are responding to the treatment, are there any faulty behavioral patterns that can be changed, or there are some psychological factors that can be treated, so that they can respond more healthily, or we can say more to the medicines, or other kinds of treatment. So this is all a job profile of a health psychologist. And because of these three four reasons, that is changing illness patterns and expanding healthcare services, advancement in technology and researches, and also the acceptance towards the medicines, are some of the reasons that why health psychology is flourishing so much. And I guess this is what I wanted to tell you about health psychology today. If you have any questions regarding today's topic, please feel free to ask about it. Is there a difference between clinical psychology and health psychology, is one of the question that is coming from one of the viewer. Yes, there is a difference in clinical psychology and health psychology, because clinical psychology deals with the clients or patients who are suffering from a psychological illness or mental health problem, like depression, anxiety, schizophrenia, bipolar, and such diseases that are affecting a person psychologically. However, a health psychology helps to uncover what is affecting a person's physical health, like what psychological factors are affecting a person's physical health. So yes, both of them are different, but a clinical psychologist can work as a health psychologist because that person is trained rigorously to in studying the human behavior, and that's how they can actually work with the medical professionals to make a really a good difference in the medical field. Also, talking about the psychological influence, some of the psychological influences or psychological aspects that can impact a person's physical health would include in the modern world is the job profile of that person, or the relationship that person is, or if there is a family environment that is very toxic, or there are so many conflicts in the family, can also affect a person's physical health. Okay. Also, so there are some unhealthy habits also. Our life is becoming sedentary, that is we are not making many physical efforts to move our body sometimes, right? And even in the lockdown, we are not moving so much. We were in when we were in our homes, and that's why it can have a great impact in the long run. If we say that diabetes was a chronic illness that was affecting a person in his 50s or 60s, that can affect our generation in 30s or 40s, maybe because we have very inactive lifestyle, or we have many relationship problems, or when we have many kinds of stress that is affecting us. There is so much competition outside, and everyone is trying to get through this race. So it is one of the it there are these are some of the psychological influences that can affect our health. Also, there is one question over here, that what licenses are required to practice as a health psychology. You don't need any license to practice as a health psychology. You can work as a clinical psychologist there in the medical field. There are some seniors of me who are working in the hospitals, and side by side the medical professional, and they are helping out the patients as well as the doctors. So there is no such kind of license required. Masters in clinical psychology or a counseling psychology is sufficient for to practice as a health psychologist. At least in India, it is possible. Any other questions you have to ask?
There are no questions. Thank you.
Okay, there are no questions. Sir, anything you would like to ask about today's topic?
Uh, I don't want to ask anything because the first question by asked me.
Okay, okay, okay.
Thank.
Right. So
You
I
want
guess I have yeah, this was all about health psychology. I wanted to talk about this because it is a relatively new field on, and not many people know about this. So I just wanted to introduce this topic, and maybe in further webinars we can actually talk something detailed aspects of the health psychology.
ma'am,
Hmm.
like in this field, health psychology, there is the any master degree in Maharashtra or in India.
Not in my knowledge, because there might be a counseling course, but mostly masters in clinical psychology is sufficient for working as health psychologist in our country at least. There is no such different course available for health psychology.
Amrut sir saying that in future there could be rules to
Yeah,
regulate practice in this field. Okay,
right.
thank. I am here for vote of thanks